Thank you for joining our presentation, A Paradigm Shift, Cultivating Proactivity to Officer Wellbeing. My name is Mariya Leyderman, and I am the Assistant Director, Executive Chief Psychologist for the Louisville Metro Department of Corrections in Kentucky. Clinically, I have been trained to provide treatment, specializing in forensics, trauma, and substance abuse. I have also worked closely with the Louisville Metro Police Department and Louisville Metro Department of Corrections since 2015 as a consultant and trainer, assisting with the development of curriculum and engaging the agencies in addressing officer well-being. The following presentation will address the stigma that is associated with mental health and officer well-being in law enforcement, examine proactive, evidence-based law enforcement mental health programs, and identify applicable techniques that may be readily integrated into law enforcement agencies. It is without a doubt that law enforcement officers have both high-risk and high-stress jobs. In 2020, there were nearly 700,000 full-time law enforcement officers employed in the United States. There's an abundant amount of literature in both the medical and psychological fields that highlights the considerable stress that officers face, as well as the serious implications. Both from a medical and social standpoint, this field of work can be costly. Police officer stress results in higher rates of heart disease, divorce, sick days, alcohol abuse, and major psychological illnesses, including but not limited to acute stress disorder, PTSD, depression, and anxiety disorders. Notably, in 2019, there were 239 officer suicides, and the rates of suicide have only continued to grow. It is alarming to see that suicide claims more law enforcement lives than felonious killings or accidental deaths in the line of duty. Despite the significant risk and stress that is associated with the job, there often remains stigma. Generally speaking, police officers are reluctant to seek help, and like many people who work in the helping professions, officers are used to being the helpers and not being in the position of looking to someone else for assistance. One of the most serious consequences of this attitude toward seeking help is the sad fact that for the last 3 years, more police officers have died by suicide than were killed in the line of duty. Often stigma stems from officers' perceptions of themselves. Officers believe themselves to be strong, self-reliant, and fearless. However, many officers also believe that asking for help or acknowledging that they are struggling is an admission that they are not those things. There is also a fear that their colleagues will not trust them or that they will not be able to handle the responsibilities and pressures of the job. They also fear the potential of not being able to have security clearance or a right to carry a firearm, and ultimately risk losing their incomes in order to be able to support their families. Stigma remains the number one barrier for officers seeking help, and this perpetuates the beliefs about mental health being seen as a weakness, unreliability, and/or failure. In 2018, the federal government passed the Law Enforcement Mental Health and Wellness Act, which is a federally established grant that has approximately $7.5 million in funding used to assist agencies seeking to implement new or enhance existing programs that offer training and services on officer emotional and mental health, peer mentoring, suicide prevention, stress reduction, and support services for both officers and their families. These agencies have adopted proactive interventions and utilized a holistic approach to officer, staff, and family mental health and wellness, meaning mental health has not been separated from a broader continuum of care and services that are closely tied to and impacted by a number of different areas, including but not limited to fitness, nutrition, sleep, healthy relationships, and financial stability. These points of intervention have been beneficial in that they have adopted early warning systems, improved how disciplinary procedures are handled, as well as enhanced training opportunities for officers. The benefits are that this reduces stigma, creates safer work environments, and normalizes mental health. Regardless of where an agency currently stands, there are a number of techniques and strategies that can be used to focus on a proactive approach. Firstly, agencies may utilize psychologists or mental health counselors and employ them into the agencies, adopt curriculum and training to focus on mental health, stress, and trauma, specifically mental health first aid and QPR training to assist with identifying early signs of mental health and suicide reduction, as well as modifying policies and integrating routine mental health checks for all officers. Additionally, Agencies may invest in wellness units and peer support programs, as well as offer resiliency training. A unique program that has been utilized in Kentucky is called the Kentucky Post-Critical Incident Seminar, which was modeled after a highly successful program developed by the FBI in South Carolina. The seminar is led by mental health professionals, as well as law enforcement team and public safety officers who have experienced their own critical incidents and received training in critical incident stress management. Ultimately, law enforcement agencies have a responsibility to challenge mental health stigma in their departments. There is no place for stigma because, to put it simply, it is costing lives. In keeping with newfound support and funding, agencies must shift towards utilizing a proactive approach to mental health. Thank you.